Welcome to today's eye review session. My name is Yejun, a second-year medical student at the University of Calgary. Our team here will present to you today about AAION, arteritic anterior ischemic optic neuropathy, as a link between ophthalmology and emergency medicine. The field of ophthalmology and emergency medicine is quite intimate. Around 2 million visits to the emergency department every year in the US are from ophthalmic conditions. And the topic we are going to cover today, giant cell arteritis, which is an arteritic AION, is an emergency. This is one of the reasons why people go to the ED. This unique and emergent ophthalmic condition, known as giant cell arteritis, is also associated with other medical fields as well. Polymyalgia rheumatica, which is a disease in rheumatology, is also associated with scalp tenderness and temporal pain, and indicated with vasculitis known as giant cell arteritis. Another link can be drawn between ophthalmology and neurology. GCA causes arteritic anterior ischemic optic neuropathy, or AAION. This is essentially an impairment in the optic nerve. So this disease that's quite mouthful. What is an AAION? So it's an arteritic category. There's also a non-arteritic AAION, but in this case it's an arteritic category of the ischemic infarction of the anterior optic nerve. Right? So there are vasculature feeding the optic nerve as well, and the anterior segment is suffering from ischemia. And there's an occlusion of the posterior ciliary circulation, which feeds the anterior optic nerve, and this is behind the lamina cribrosa of the optic disc. The arteritic classification is due to the giant cell arteritis that occurs. So with giant cell arteritis or temporal arteritis, you'll get scalp tenderness, the jaw claudication or tiredness from using the jaw repeatedly over a long period of time, and also temporal pain. Let's take a look at the vasculature where AAION and the GCA can occur. So there's the internal carotid artery leading from the heart all the way up into the neck and into the head. This turns into the temporal artery as it crosses the temporal area of the head, which then branches out into an ophthalmic artery and then to the posterior ciliary arteries that feed the optic nerve. People at risk of AAION are patients over the age of 55 or patients with polymyalgia rheumatica. Polymyalgia rheumatica is an inflammatory disorder that causes widespread aching, stiffness, and flu-like symptoms. And the most common presentation of polymyalgia rheumatica is the pain and stiffness in the shoulder muscles, as well as the necks and the hips, and also the morning stiffness. Here are some of the symptoms of AAION. This commonly occurs as an acute unilateral and painless vision loss. There's a triad of scalp tenderness, jaw claudication, and the temporal headache that I mentioned earlier that's associated with giant cell arteritis. The AAION can come with B symptoms such as fever and weight loss, and it can also occur with dyschromatopsia or loss of color vision. Polymyalgia rheumatica does not always happen with AAION, and also AAION doesn't always happen with polymyalgia rheumatica. This is a joint pain and inability to lift the arms beyond 90 degrees, so girdle limitations of the range of motion. The AAION, because it's unilateral, can also present with diplopia. And the history of transient vision loss needs to be ruled out because amaurosis fugax can accompany this disease as well. With AAION testing visual field, you'll notice that the patient often has central or altitudinal visual field defect. Upon observing the pupils, the patient will have an RAPD or a relative afferent pupillary defect. This can be confirmed by a swinging flashlight test. While normally on perception of light and stimulation of the optic nerve after that, the pupils will constrict in response. However, if the light sensing system, the cranial nerve 2, is impaired in the other eye, upon shining light at that eye, the fellow eye will receive less light in comparison. This will result in dilation of the pupils instead of the maintenance of constriction. When observing the back of the eye with fundoscopy, there may be swollen optic disc as well as swollen and tender temporal artery upon physical exam. On back to fundoscopy, you also find cotton wool spots indicating ischemia, and in the late stage, you'll find optic disc cupping and elevation. In this eyepiece, we have learned the links and the epidemiology, symptoms, and signs of arteritic anterior ischemic optic neuropathy. In the next eyepiece, we will learn the differential diagnoses, history and physical exam, investigations, treatment, and prognosis of AAION.